Hi and welcome. My name is Catherine De Rivera. I'm Chair of Environmental Science and Management, and I'm really glad to see you all here. ESM, Environmental Science and Management, focuses on the interplay between human and natural systems and addresses the effects of environmental stressors, such as climate change. Our goal is to provide students and I see many of them here, the skills and critical training opportunities they need to perform effectively in environmental careers, and to understand the complexity of the systems around us so that they can join us in developing solutions to problems with social and ecosystem aspects. It's with this in mind that we were thinking about the houseless. And I'm so glad we had the opportunity to invite Dr. Rodgers here to talk about the complexities of this issue and bring his insights into it. He's a thoughtful man with years of experience. Initially serving as Community Environmental Health and Toxic Section Manager, Dr. Rodgers is now the Assistant Division Director for Community Toxics, Science and Policy for the Environmental Health Services Division in King County, Seattle. Prior to going to Seattle, Dr. Rodgers worked with the Center for Disease Control as the Associate Director for Community Environmental Health. And he also worked for the US EPA in regulation development for toxins. He also worked for Michigan's Kalamazoo County as an epidemiologist and manager for communicable disease. His PhD is in environmental toxicology, and he has postdoctoral and MPH training in environmental epidemiology. He's been pivotal in implementing an equity and social justice lens in the environmental regulatory work and services provided by King County. Along with his team, he's helping transform the impact and delivery of critical services to protect human health and the environment. Without further ado, I'd like to introduce Dr. Darrell Rodgers to talk with us about homelessness and the environment. Thank you.
Good evening. How is everybody today? Great. I am happy to be here in your beautiful city today. This is my first time in Portland. Thank you. And after getting off the train, I was greeted by quite a few homeless people. So that was like, okay, this is why I'm here. and I definitely see the similarities here between Seattle and other cities around the country and here in Portland. It's nice to actually come to a place where people actually want you to come and speak versus not wanting to hear from you, because I started off my career, of course, in academia, like in here for half of it, and then I went to the dark side and went to regulation. And you're not very welcome in a lot of places, but it is a pleasure to come and share what I've learned and to hear back from you and to engage with you on on this very important dialogue regarding homelessness and what it means and how it is impacting our environment and how the homelessness is impacting the people who are homeless as well. So I'm pretty much going to give the talk and kind of take questions at the end. However, if you've got a burning question and you just got to get it out, please let me know. I may give you a couple of prompts because I'd like this to be an engaging exercise for the 45 minutes, 50 minutes I'll be speaking, rather than just kind of talking at you. Learning is always a two-way street, and it's far more fun for it to be interactive and far more interesting. So, without further delay, as you can see the nice long title, which is obscene. So let's go to a simpler title, okay? Homelessness, Environment, and ESJ. So, most of you have a understanding of what homelessness is. Of course, you know what the word environment means. How many of you are familiar with ESJ? or equity and social justice? Okay, a few of you, good. So, King County has an equity and social justice ordinance, as well as the city of Seattle, which defines equity and social justice as a foundation on which all people have access to opportunities that enable them to live a full life and benefit from the fruits of our society. Using an equity and social justice lens, people are allowed to have their fulfilled potential regardless of race, class, economics, gender, sexual orientation, country of origin, or language spoken. And it addresses the concerns of structural injustices or institutional injustices and biases that are inherent within our system, which prevent members from fully having access to benefits by virtue of being less advantaged than others. And again, that would refer to their race, their gender, their age, their sexual orientation, and so forth. So the reason this is important is because the subject of homelessness and how it is addressed cannot be discussed without humanizing the topic. We talk about encampments, we talk about the environment, we talk about the homeless, we make them into an other. And by that, we then create institutions, policies, and behaviors that basically treat people as if they are no longer human beings, sentient, existing human beings just like you and I. So you have to ask yourself, and I asked myself this when I first became curious about homelessness in the 1990s, why were people homeless? I was a newly graduate from my PhD program. I was off doing my postdoc in New Mexico and also getting my MPH in environmental epidemiology. And I saw lots of homeless people, and I was curious as to why they were homeless. Because I thought, well, I've had times where I've been between apartments, and you know, everybody has a relative, everybody's got a cousin or a grandfather or an aunt, or you can sleep on someone's couch. I didn't understand it. So I thought to myself, well, okay, I'm going to volunteer at this shelter. By that time, I had a little bit of sense to not throw so much judgment into my own preconceived notions. And I volunteered at a homeless shelter, and I had a chance to meet the men and women there and to talk to them. And I had a nice, unique role where I was working in a dispensary where they would come and tell me the supplies that they needed, mostly personal hygiene supplies, also batteries and other things. And they would sit there and just talk to me while I was at the window. And I got to know them. And a lot of them worked jobs. A lot of them were abused. Some of them admitted that they had chemical dependency. Some of them were just plain lost. And like many people, some of them were 1 or 2 checks away from homelessness when it happened. So the easiest explanation that you hear people say all the time, not everyone, but people do say, and I'm sure you've heard it, is that, you know, these people, it's their fault, they're drug users, right? They're irresponsible with money, they don't know how to budget. They're too lazy, they don't want to work. Or they must want to be homeless. And these are very common, all too common, if you will, responses to the problem of homelessness, and they fail to address some of the substantial or substantive causes of homelessness, such as institutionalized oppression, which prevents access to the basic rights and privileges that others enjoy in our society based on the things that we mentioned earlier. The criminalization of homelessness. Lots of public outcry from homeless encampments, homeless people walking down their streets, homeless people urinating in people's yards or displaying behaviors in public that people do not find socially acceptable. And I'm not justifying that. And I'm not saying people don't have a right to be upset, because I wouldn't want to see it either. It's disturbing. But you also have, but it's not criminal. But we've turned it criminal because it's convenient and easy to deal with. You've got places around the country that have now instituted homelessness or anti-homelessness laws and ordinances where it's basically illegal to be homeless, to sleep outside. It's illegal. You get arrested. Where they bulldoze down any encampments that may pop up, and they throw everything away that people have. So you may ask yourself, I know this is an environmental program, and we're talking about environmental impacts, but you cannot talk about the environment without talking about the people. What's the point of having a pristine, clean environment if not for all of our collective benefit? Invisible. Homeless people and homelessness is pretty much invisible, at least until it is not. And that happens when we're inconvenienced. The man is urinating in front of our child. There's garbage in front of my house. I'm walking past needles in the street. I'm afraid for my children. All of those other conditions. And they are justifiably concerning to an individual and to a family and to a community. They're not pleasant to watch. We've turned it into a thing. It's homelessness. It's not so much about the people anymore. And there's a need to kind of, again, rehumanize this issue. They become other. Even the words they that I'm using now is suspect. But it's very difficult to even have this conversation and figure out the right terminology to use, because the media and the language that we use, the books that we read, this language is so prevalent till it permeates our whole way of thinking and creates a whole category of other. And I'm bringing this up because I want you to, if I can have you just take away today, when you read about issues regarding homeless people and their situations and their plight, that you keep in mind what kind of language, what words are being used, which of those words are being used to kind of persuade you one way or the other, so that you can think critically and independent and make your own decisions. Sometimes we don't see them because we're uncomfortable with our own privilege. Now, privilege does not mean unearned here. You're going to school, you're getting an education, you expect to make a job, to have a job and make good money. Yeah, you've earned that right. But it is still a privilege in a way, because not everyone has that access. You do. I did. And I took it for granted for a long time. Still do. But then things happen that remind me I am quite privileged, despite what I may have had to deal with as a man of color in society and my struggles. I'm still male. I enjoy male privilege. I'm educated. I enjoy educational privilege. I'm not poor. I enjoy economic privilege. I'm not rich, but I'm rich in friends. But you get the gist. It's also overwhelming. You want to turn your head, don't you, when you see people like that, because you don't know what to do. It's like, what can I do? Is $1 going to help that person, really? Is my giving them a sandwich? Okay, for a moment. But how many times can I do that every day? And then when I give that $1 out, all I have to do is really literally walk 5 feet to 10 feet, and there's another person in need. And I can never get to where I need to go. Because you know what? I'm busy. I'm multitasking. I've got emails, I've got assignments, I've got people to meet, I've got children to pick up. I got a lot of things to do. And it's not my fault. And I do give money. I give money to charities. I give money to organizations that help. So these are the things we tell ourselves, and they're all correct and nothing's wrong with that. But it's important to be cognizant that this is what we're telling ourselves. This is this picture I put in here because he says, if you can't give him any money, you can't help him, or whatever it is he's asking for, can you at least give him a smile? He's literally asking, can you at least acknowledge that he is human, that he exists? And I'm seeing that more and more, because as this problem is becoming as pervasive as it is, the problem of housing and adequate resources for people, we're becoming overwhelmed as a society because we don't know what to do, and we're turning our heads even more at it. Because when I walk down the streets of Seattle, literally, there are homeless people in need everywhere. And guess what? I've got 5 minutes to get to that next meeting. What am I supposed to do? He's saying, can you smile at me? In the United States, these are some of the numbers for homelessness as far as its pervasiveness. New York City, Los Angeles ranking second, Seattle, King County third, and close behind is San Diego. And we'll get into San Diego and Seattle a little bit more as the talk goes forward. It is increasing. The divide is becoming more and more pervasive. There are several groups that are some of the fastest amongst those becoming homeless. So one of them is children. Children being defined under 18 years of age. Some people go up to 24, depending on what organization you're talking about, or 21. But there are several others too. Those with disabilities, their numbers are going up as far as unsheltered homeless. Gay, lesbian, transgender, bisexual teenagers, they're going up. Veterans are going up again, and other groups. Some groups are going down, but it just kind of depends on what the resources are in that region and when you ask the questions and when you collect the data. For the West Coast, Pacific Northwest, so you got Los Angeles at 38% increase over the last 2 years, Alameda County, Oakland at 61%, and Seattle at an increase of 45%. And here in Multnomah County, down 11.6%. You all cheated. Says right there we used a different count, but no. You're actually doing some pretty good work, and you're to be commended on it. I was researching it before I came, and you're aggressively tackling some of the hard issues, and I encourage you to please keep it up and ask those questions and face those challenges, because again, this is a community effort. I know I'm spending a lot of time before I get into the environmental stuff, but it's really necessary to set the stage here. And it's important to acknowledge where there is success. Okay, environmental impacts of homeless encampments. In considering and talking about the environmental impacts, it's important to, again, remember that you're talking about a population that is very sensitive, but you cannot ignore the impact that these encampments are having on the environment. They are impacting the environment. They are impacting the quality of life. They are impacting the enjoyment of parks, of their safety issues because of, hypodermics or public intoxication and other issues. And sometimes people have mental instabilities, and they can be a danger to themselves and sometimes to others. But then again, you know, that's an average family reunion as well. Trash, hypodermic needles, gray water, drinking water contamination, and hazardous waste. And environmental impacts of people experiencing homelessness is relatively small, though, in comparison to the blueprint, the carbon blueprint, and the usage of fuels and trash produced by those of us that are housed. It is very, very small. It makes big news because it's headline, because guess what? Our trash goes in nice receptacles, and we pay someone to come and take it away, so it's out of sight and out of mind. So then you've got this family here, or couple, or single woman, or child on their own. They don't have a toilet. What are they going to do? They have to go. They don't have a place to put the trash. They have to eat, and they're not cooking, so pretty much it's going to be some fast food or something they bought from a store, or something that someone bought and gave them. What are they going to do with it? In Seattle and King County, we try to focus on preventative measures to, first of all, reduce communicable diseases and illnesses in our homeless population. We try to attack the source, if you will, and the causes of those illnesses and exposures. Because people experiencing homelessness are, again, critically vulnerable populations, and we have identified them, and we know that they are much more susceptible to foodborne illnesses and other sources of contamination, such as water, because they do not have protected sources of food. And one of the ways, believe it or not, in which people get sick who are homeless is from donations from good-hearted people who bring them food. So you and your group, you say, let's get together and let's cook a bunch of chickens, or let's go buy all this prepared food because we know they can't cook it, and you give it to these encampments or these individuals. What are you going to do with the leftovers? What happens to them? They spoil. They rot. They make people sick. They attract rats and mice. They create filth. Better to give your donations to an organization that is trained to manage donations to the homeless and to help them than to just kind of do it on your own. I'm not saying don't give a person $1 or give them a cent. I'm not saying that. But large-scale, unorganized deliveries of food products really should be handled by professional organizations that know what they're doing. There are unsanitary practices that draw rodents and create hazardous living conditions. Again, there's no trash cans for people to put stuff. So that's another reason why you can't give too much. I've been to encampments to help them organize, and I have literally seen long rows, 20 feet of bread stacked 4 feet high with all the bread on the bottom molded. A person who is compromised mentally or aged, they could eat that. Or if they're hungry enough, they might eat it. Who knows what you would eat if you haven't eaten in 3 or 4 days. That's my beautiful skyline in Seattle, with almost 12,000 people homeless, 5,500 unsheltered, and 3,500 in shelters. And I guarantee you, without a doubt, those numbers are underestimated. That's simply who we've been able to count. People are learning to hide because they know, even in the most enlightened city, with the best intentions, there are people who will attack them, who will penalize them, they will be criminalized, they will be discriminated against, and all the other, even in cities such as ours, because it does happen. So let's talk about the types of encampments. About 3.5, 4 years ago, we had an encampment called Nicholsville that was so large. It was over 300 tents and individuals. It was massive, and I had just started there not that long ago, and it was out of control with respect to the rodents. Public outcry was at its highest, and I had never in my life seen anything like it. So I immediately, called some different people from some different areas together, and I said, I said, people wanted to act. That's what you want to do, right? You want to act. I said, stop. We don't even know what we're doing. Can we first understand the problem? So we created this massive table of different types of encampments, different types of homelessness, about 10 or 12 of them, and all the different types of environmental conditions we could think about. We identified what resources we had, what needed to be done, and how we would implement them, and then what was still remaining. And we still use that table. I can't show it because it's so big it wouldn't fit on one slide. I couldn't even show you a piece of it, but it helps guide us in our work now. And just as an example, some of the types of encampments that we identified were organized and sanctioned encampments. Does everyone know what sanctioned encampments are? That's kind of a new word that's going around. Sanctioned means sponsored, or it's okay, it's legal. An organization, a city, Seattle has sanctioned encampments, where the city itself identifies certain locations and they say that it is okay for a group of homeless individuals to set up their tents there to live, and the city helps them with a grant and a management organization to help manage their donation, their health, and other things like that. It's by no means a fix, but it's certainly better than people just living in the woods without any resources whatsoever. Those are sanctioned encampments. Then you've got the individual people who put up tents or in groups of 1 or 2. Then you've got what we call freestyle. Those are the encampments that can get really large and can become very dangerous for the people who live there and for the people who just are near them. We had one of those last year. We actually had to testify before the Washington State Senate Subcommittee. It's called the Jungle. There was a jungle in California. Some of you probably heard of that one, right? We had one too, under I-5. It had been there for over 2 decades until earlier last year, someone went down there, something happened, and a lot of people were killed. And then there was this massive state effort and local effort to clean it up and relocate the people. It was something I've never seen anything like that either. I didn't even know that existed, and I had been living there for several years. That's how pervasive this is. People didn't even, law enforcement, medical assistance would not even go near it. And even still today, we have areas in Seattle and in King County where the police will not go. And you've got squatters, you've got car campers. This is on the increase. People are camping in their cars and RVs. Why would you think that? It's safer for them. It's some shelter, And they can also move and flee if they get chased out by the police or if something dangerous is happening. And it gives them some kind of control over their lives, some mobility. And then you've got the protest camps, which I think we've all kind of heard of those, where people are rallying against or for something or against something. I found this when I was preparing this presentation because I was curious as to what's going on in Portland. And there's a couple of things here I want you to notice. First of all, when I talk to you about language, look at the title of this. And this is what was there printed, the title. Portland Homeless Sweeps. So, okay, on first glance, okay, so this is where they got rid of those horrible encampments in Portland, right? But then you start thinking about sweeps. What do you sweep? Trash, garbage, litter, debris, refuse. There's nothing in there that talks about people. But this is what's being swept. And I'm not saying that these encampments should not have been moved or relocated or the people given services. I'm talking about the way we refer to them. Again, they're not even human. From an environmental standpoint, what stands out in the picture? This is the first thing that caught my attention. Yeah?
Down under the bridges next to the inner subdies. I mean, that's where the shelter is. Yeah, it's close to the water, it's where the shelter is.
A lot of them are close to the water. And why do you think that is? People need water for various things, to cook, to bathe, to relieve themselves in. And it's usually not populated. It's usually businesses and homes are a little further away. So that's how we wind up getting a lot of environmental contamination, is through waterways as well. California is going through this big time in a lot of their areas. And you are too. And so is King County in Seattle. So, with respect to the environment and hazards, you've got water contamination that can occur from encampments. You have air contamination that can occur from things like fires and other things that are being used. You have soil contamination that can occur from hazardous chemicals and human waste. You have other hazards such as rodents and mice. Rodents follow every encampment. They're always going to be there. It's just a given. The waste, the fires, the chemicals, the sharps, and other substances. This is people that are taking samples of a contaminated stream. We've had to close shellfish beds periodically because of a homeless encampment being close to a shellfish harvesting site, and people were using the water. We actually had an outbreak of norovirus in Washington State. They haven't definitively said it publicly that they believe it came from an encampment, but it's strongly suspected. We get people who die in these encampments from falls. They encamp on freeway banks and places like that out of the way where no one's going to bother them, where they think it's safe, and they roll off. We have a couple every year that fall to their deaths. We have fires that occur from people trying to heat themselves or cook or do other things. So, rats and mice are pervasive. They also spread out into the surrounding community. They don't just stay around the shelter, around the encampment. They go out into the community. The garbage spills out into the community. The human waste accumulates and is very unsightly and unpleasant. The sharps and the biohazards accumulate in the surrounding area and within the encampments, and they compromise the enjoyment of your parks and of your neighborhood. And then you have the dangerous flammables and fuels and things like that that contribute to fires. These are all environmental concerns. So you wind up with conditions that are unsanitary and inhumane. And this is language I used when I gave an interview when we had to clear out an encampment I'll show you pictures of shortly. But unsanitary and inhumane environmental conditions lead to disease transmission. As a public health person and a person who is responsible for enforcing regulations with a lens of humanity, my job is to ensure that public health is protected. Those who are impacted on either side of whatever the situation is going on. A good example that's happening right now, hepatitis outbreaks. They've happened in Arizona, and it's happening right now where? It is completely off the chart. They've declared a state of emergency over their hepatitis A outbreak. They have put notices up because they are, and this is really unprecedented. I have never seen this before in all my years of working in environmental public health. Spraying streets with bleach. That's how bad it's gotten. As of this last Tuesday, San Diego is has the fourth largest homeless population in the U.S. They count about 5,600. Again, it's underestimated. But this outbreak has affected a minimum of 481 people. There have been at least 17 deaths as a direct result of it since Monday. The city has now removed the tents. They have put in portable toilets, open and guarded 24 hours a day, more than 60 hand washing stations throughout the city, workers in hazmat spraying bleach on the streets and sidewalks, and they're doing massive hepatitis A vaccines to the homeless. So what do you think the lesson here is? Think this was preventable?
Yes.
Did it have to come to this? They shut down. They wouldn't let people use bathrooms because they didn't want them there. So guess what? They went in the street. Now, they're in a crisis. But they're handling it and they're learning. We are trying to learn from this too, so before it happens to us, as you should too. So assessing the impact on the environment on the homeless, and I'm going to say the individuals, but I want to be clear. Sometimes we use the word homeless. What is, we talk about the homeless. We're talking about people, human beings, mothers, fathers, daughters, sons, grandparents, pregnant women, children, someone's aunt, someone's uncle, someone's beloved, a veteran that served this country, an elderly person whose Social Security is not enough. We're talking about real people. They're affected by rodent-borne illnesses. So this is the environment now impacting them because of their homelessness, which I would hope you all would think is not their fault. Rats and mice are vectors for disease through their feces and urine. There are other disease vectors carried from the ticks and fleas that they have. But rats are attracted to food sources. They are indiscriminate. They don't care. And encampments present a common problem because food storage and donation management is difficult, if not impossible, to support. Foodborne illnesses. Problems among people experiencing homelessness by well-meaning individuals who are also people or groups that donate food, who unwittingly distribute a source of disease among vulnerable populations throughout donated foods. This very well could be how the hepatitis A outbreak happened in San Diego, but until the epidemiologists figure it out, and they probably won't, we don't know. Waterborne illnesses. You saw encampments are near bodies of water. People bathe in them. People use them. People walk through them. They may even use it for cooking water, thinking that once they boil it, it's okay. Or they might even just drink it. poses a significant health threat to them and their pets. Giardia and other illnesses are present in these water sources. The air and water contamination, because you find many shelters that are detrimental to people's health, including those under bridges and overpasses. If you think about all those emissions and fumes that people are inhaling, and you don't even see them because they're tucked away underneath the bridges. The proximity of many homeless people to these sources of pollution through self-reporting is shown to be double that for respiratory illnesses in the national average. So this is one encampment, just one, in Seattle that we worked on in May and June of 2017, and it was something else. It was right smack in downtown Seattle. And less than 2 miles from, let's see, the Cartier store and the, Louis Vuitton store, and all the wonderful restaurants that we enjoy on Fifth Avenue, less than 2 miles, and within about 0.8 miles from where I work. These are the conditions, the everyday conditions that were there. They were living in a mud hole in downtown Seattle. And you saw that skyline, right? And this is what's there. And yet, okay, business as usual, but we don't like it. So something was done because it became too much for people to look at, and the concern, the overflow, it got out of hand. So we went in and we started trying to give people services and address the problem. It was not pretty, it was not pleasant. And this is the aftermath. Doesn't this look like a natural disaster? But it wasn't natural, but it was a disaster. Look at this. This is after the people left. This is what's left behind. And you see all that stuff. How much you want to bet most of that was donated? What were they going to do with it? Again, the donation management. Sanctioned encampments are not a solution, but they do help. This is after they left. Okay, mitigation and prevention strategies that Seattle's emergency response to homelessness have done. In November 2016, they declared a state of emergency for homelessness by the mayor and the county executive. In February, we convened an emergency operations center. I participated along with some of my staff, where we attended weekly briefings and daily plans and activities to humanely address the homeless issue and get people services without trying to just sweep them away. It was extended in June it was initially 90 days. We extended it in June. And we deactivated just this month. But there's still efforts going on. We had 9 missions to find at least 200 beds, reduce the trash, mitigate the hazards, have a multi-departmental approach and remove barriers, to engage the public and mobilize the community to create awareness, provide training, and to communicate with the public what is happening here. And particularly from an environmental standpoint, we worked on Mission 1, which was to help, the safer cleaning living spaces, and we gave lots of advice and on the mobilization. We developed guidance documents for how a sanctioned encampment should be run and how it should be maintained to avoid some of the environmental hazards. We worked on mission 2 to reduce the trash, to protect the public and the workers who are cleaning up the trash, with guidelines and reviews for sharps management. And we also worked on mission 3 to connect people to services and mitigate some of the most hazardous encampments. That one I showed you the pictures of, that was one of the ones we had to do something about. And again, there's a lot of trauma going on here, and there's a lot of care. There's not only trauma to those who are homeless, but also to the people who are providing services to them. So I'm going to wrap up here in a few minutes. So what's next for us? We're developing strategies to combat a potential hepatitis A outbreak should it occur, and hopefully prevent one from occurring by doing outreach and response. We're setting up new sanctioned encampments where they will have an organization overseeing them and helping them to maintain, well, some kind of standard of living. I don't even know the right words to use, but it's better than having nothing, I suppose. We're maintaining a guidance document that we developed, and we're sharing it with all types of cities and other jurisdictions on this is how and the lessons we've learned to help an encampment function safely, if you must have one. We're advocating for sustainable funding for response. And starting this Monday, when I go back, I'll be sitting on a several-day review of RFPs for management companies who will be overseeing some of these encampments. We're using our equity and social justice lens to understand the trauma that people are going through, especially with transportation, grocery, community support, access to housing. We're working on things like the block project and low barrier options so people and families can stay together and they can keep their pets, and alternatives other than the traditional shelters, which many people don't want to go to because they say they're very dangerous and they're filthy very often. So that's sustainable change. You have to use a holistic approach, mental health services, again, issues of transportation, resources, housing, model intervention programs with respect to resources, planning, execution, evaluation of those programs. They must be community-based. You cannot impose this on a community. A community must develop this within to help them address this. Continuing education for the people who are experiencing homelessness, as well as those providing services, spreading knowledge and education of the community using our ESG lens. And I want to end with a nice project that I've had the pleasure of working with. A guy named Rex Holben, he's got a TED Talk out. He's an architect who wanted to do something about homelessness in Seattle. And I think, and there's some similar things going on here in Portland with respect to small houses, tiny houses they call them. And the goal is to put a house in every block in Seattle that's fully self-sustaining in the backyards of at least one house on every block. And the first house came online in September 2017, with more to come. It's called the Block Project. These are the people that got together as a community and volunteered their services to put that house together. And this is the actual house. And there's actually a couple that live there. So, thank you.
And they're Dr. Rodgers.
What's the best possible way for us to, I guess, volunteer our support to homeless communities?
So the question is, what's the best way for us to volunteer or support homeless communities?
I would say find an organization that is already doing the work. There are many organizations that have skilled people who are trained either in mental counseling, either in providing services that can then use your talent. They can use your talent to help them accomplish those missions. I would not recommend doing it on your own. There are many, many organizations. So I would find an organization that's doing the work and one that fits in your schedule and with your values, whether that be religious, social, political, however, whatever it is. Some are just political, where they want to advocate for housing and they can write and they will petition, whatever fits you, but that's what I would do. Sir?
Could you please elaborate on what donation management is?
Donation management is good meaning, well-intended people will buy supplies and food, and they just drop it off at these encampments. Here you go. Here's a bunch of pillows. Here's some blankets. Here's all this food. But the people don't have any way to take care of that stuff. They don't have any place to put that food. They don't have any way to carry that stuff with them when they have to move. That's where all that garbage comes from. You saw sofas and things like that. People thinking, well, here's a couch you can sit on. Some people instead of going to the dump, they will take their stuff to an encampment and say, here you go. So guess what? The people take it. They're like, hey, okay. So they take it. Donation management is managing what comes in so that it is actually usable and that there's a way to take care of it, maintain it, and move it or dispose of it when the time comes. Okay? Yes?
Why there are so many homeless people in Seattle?
Oh, Portland's busing them there. No.
Didn't notice our difference.
Yes.
So the question was, why are there so many homeless in Seattle?
A couple of
New
reasons.
York.
You said versus New York or just along the West Coast? So it seems to be, there's a huge epidemic. You used to see stuff like this really in the on the East Coast. This surgence on the West Coast, I believe it's related to a temperate climate. The communities are more progressive in their mentality and less hostile to people who are homeless. There are actual laws that are actually trying to protect the people who are experiencing homeless versus penalize them. And to be honest, there is evidence to suggest that other districts, other regions give people bus tickets to our cities. So that's what it suggests. So those are just some of the reasons. Yes?
You had mentioned earlier that PDX or Portland was tackling some hard issues, and I was wondering if you could, and so as to keep it up, I was wondering if you can elaborate what those hard issues were that we were doing so well at.
Well, the issue of housing. You've been working very hard and finding housing and shelter. There's two avenues there. One, the first thing is to move people from unsheltered environments to sheltered environments, if you can. Ideally, into some type of permanent housing or transitional housing. So you've made progress in that. You've also had a decrease in the number of people of color who have been experiencing homelessness. I think there was a drop. I forget the exact percentage, but there was a drop. Because people of color are disproportionately represented in the counts for homelessness, just like they are in other demographics because of those institutional barriers and discrimination and oppression that I talked about. So there's been progress there. Things like this is progress, the awareness. You've been doing an awareness campaign. So there's quite a few things. It's pretty easy to kind of find it out, but those are some of the things I came across. Okay? Did someone, you? Yes, sir.
Thanks for the talk. I'm wondering, in your work, you're doing a lot to respond to the environment as it is in a relationship with homeless folks. So how much,
In relationship to as it is with?
with houseless individuals,
Yes.
how much are you looking at the bigger picture in terms of the larger built environment and the fact that it's not really hospitable to humans unless there's a certain social, economic needs?
We have a program called Healthy Housing and Community. And that program, along with our climate change program, is looking at that broader issue. I work with them a little bit, but of course you can't specialize in everything. But they're actually looking at that whole issue. And Seattle has been working on that issue for quite a while now, through a couple of administrations. And I actually heard about it when I was working at when I was working at CDC. I was so impressed by it. I had never been to Seattle, and they gave a presentation on what they were doing for that sustainability, for growth management. And we have growth management plans and all of that, because our housing is now ridiculously unaffordable. And I think Portland's is pretty much the same way, right? It's almost unaffordable. So they are looking at those things, but right now I haven't seen any solutions, but they're looking at them. But again, that's politicians, policymakers, and they're working in that area, and I'm working over here. So, but they are looking at it. Yes?
As far as environmental quality is concerned, specifically water, how do homeless encampments affect water quality?
Well, several ways I mentioned. One, the biggest effect is fecal contamination of water bodies or wells. Rarely wells, because homeless individuals have a tendency to kind of camp in urban areas. But there's lots of times the ones who have RVs, they just kind of will spill their stuff out in the street from their toilets. So, and it gets in the water systems, the drains, and it runs into storm water, which kind of commingles sometimes. It can infect shellfish beds if they're near bodies of water that are used for recreational purposes, for either shellfish harvesting or swimming, and waste like that. And it can also just, water is a really good carrier and vector for disease, because it's kind of just everywhere, even rainwater. You know, if you've got some rainwater that's contaminated and you're out walking and you drop something, you reach down, pick it up out of the rain, shake it off, it's on your hand, and then in your mouth or on your face. And so it kind of impacts it that way.
Is it something that we should actually be concerned with our water quality near homeless encampments, or is it something that is kind of...
You have to assess it on an individual basis. Every encampment behaves differently. They're all different. Some self-govern, and they self-govern themselves very well. They don't allow people to do certain things because they don't want to draw attention. Some don't. It really depends on that encampment. They are all different. Any more questions? Yes?
So like natural, you mentioned encampment looking like natural disasters after people leave.
Yes.
And the increase of catastrophic natural disasters, hurricanes, here in the Northwest, potentially like earthquakes.
Yes.
So are homeless considered into doing those, in planning for kind of like actually,
Only recently, as indicated by, we activated our emergency operations center. We declared a state of emergency. I believe, didn't you guys declare a state of emergency also? That is an activation of the emergency system. So it's a change in thinking, because this is a situation. These are situations now where our traditional structures and ways of handling things does not work, and is not rapid enough and not responsive enough. So they are now using emergency management thinking to try to tackle the problem. But the challenge is to keep the humanity in it. Any other questions? Okay, two more, and then I will close. You first, and then you.
You mentioned community-based work with homeless people.
Yes.
Have you seen some good examples of that?
Yes, there are lots. There are lots. We have two organizations, Share and Wills in Seattle, who are doing really good work. We have a group, Wills is a group of women who are battling this issue of homelessness and bringing attention to it and awareness. So in Seattle, we've now had, this year alone, we've had, I think, somewhere around 68 deaths of homeless individuals, and which exceeds the 62 or 64 we had all of last year. So we've got people dying every day, but you've got these organizations that are out there bringing awareness. You've got them writing letters, insisting on policy. There are hearings at the city council and county levels. The politicians are listening, but it's a constant vigil. And they are trying to creating services for the individuals who are experiencing homelessness. These sanctioned encampments are a direct result of communities insisting that we do something. And last one was over here.
I just wanted to real quick mention something about the donation management. It was interesting you said that because Radio Cab does a Christmas box every year, and one year, about 2 years ago, they did a bunch of them and they'd been eaten up by rats. And they went ahead and gave them out because they didn't want to maybe get rid of, either pay to get it to the garbage. And when you mentioned that I had never really thought of it in that fashion of exactly why it happened and why they were giving them out. It was just strange that it happened. And then one other point was, how do bed bugs affect any of what you were talking about?
They're pretty bad. They're really bad in the shelters right now. They're very bad. Bed bugs have made a resurgence in the U.S. We got rid of them with DDT a long time ago. We all know that that's bad. They have come back with a vengeance, and the homeless are prime targets for them. So, I want to thank you all for having me. It has been a pleasure.